My name is Beth Cloud-Biebl, and I'm here with my colleague Joseph Mozingo to describe our poster, The Effect of Load on Subacromial Space During Arm Elevation in Individuals with Spinal Cord Injury. Before we get started, we'd like to acknowledge our co-authors, Ruth Dolan, Lexi Clawitter, Travis Colbo, Drew Sathram, Megan Van Straten, and Kristen Zhao. This work was completed at Mayo Clinic in Rochester, Minnesota, and funding support was provided by a training grant from the NIH and a grant from the Minnesota Partnership for Biotechnology and Medical Genomics. Now I'll pass it off to Dr. Mozingo to tell you a little bit about the work.
Thanks, Beth. So we know that the majority of individuals with spinal cord injury experience shoulder pain, and this pain is multifactorial in nature. One of the contributing factors could be mechanical impingement of the rotator cuff tendons. And this is important because for individuals that rely on use of a manual wheelchair, when completing activities of daily living, the shoulder must be used in a variety of planes as well as to support different levels of loading. So this work was part of a larger study aimed at understanding how arthrokinematics as well as risk of mechanical impingement to the rotator cuff tendons vary as a function of different daily tasks. And this study in particular, we were interested in understanding what effect external loading has on the subacromial space during an arm elevation task. So now I'll walk through our methods, which are highlighted in Figure 1. As part of our study, we leveraged a technology known as Biplane Fluoroscopy, which allows us to measure 6 degrees of freedom motion, in this case of the humerus and scapula, with a high degree of accuracy. In addition, the advantage of this technique is we're able to make measurements directly from bone surfaces, which allows us to measure the subacromial space. So in this study, we enrolled 10 participants with thoracic level spinal cord injury, and we acquired dynamic X-ray images of the shoulder joint as they completed an arm elevation task seated in their personal manual wheelchair. We acquired 3 different trials, one each at a different level of external loading, without an external load and at 2 and 4 kilograms of external load. After completing the X-ray exam, we obtained a CT scan of the dominant arm, and were then able to use model-based tracking shown in the middle of Figure 1 to register a 3D bone model generated from our CT scan to our dynamic X-ray images. As a result of this process, we then have quantified the rotation and translation of the humerus and the scapula over the course of the arm elevation task. Lastly, with these known positions, we can then measure the distance from rotator cuff tendon insertion sites on the humerus to the overlying scapula anatomy. And we did this at discrete intervals of glenohumeral abduction. Now I'll hand it back to Beth.
So as Joe mentioned, with the data that was collected, we were able to define the subacromial space and look at glenohumeral kinematics. We evaluated all of these outcomes using a 2-way repeated measures ANOVA, where we considered the impact of load as well as the impact of the amount of glenohumeral abduction during the task. In Figure 2, we show our subacromial space outcomes for the 3 tendons of interest, the supraspinatus, infraspinatus, and subscapularis. With our definition or estimate of subacromial space, we did not see a significant impact of load. However, we did see that the subacromial space changed throughout the task. The supraspinatus and infraspinatus had their lowest values at 60 degrees, and the subscapularis had its lowest value at 80 degrees. Moving on to Figure 3, we see our glenohumeral kinematic rotations. We didn't see any significant impacts of load or the glenohumeral abduction angle here. In Figure 4, with humeral translations, we did see that there was an interaction between the loading condition and the amount of glenohumeral abduction on superior and inferior translation. However, the magnitude of these differences were quite small, and they didn't seem to impact the subacromial space, so we didn't see a similar effect in that outcome. So to summarize our study, the primary result that we saw was the impact of the amount of glenohumeral abduction on the subacromial space value. Though loading up to 4 kilograms didn't seem to have an effect. So if we consider how this might impact things clinically, we can consider it in the context of prescription of exercise. If we're prescribing a scapular plane abduction exercise with our patients, up to 4 kilograms of load may not impact their risk for compression, at least in the way that we've defined it. Though it should be noted that in our study, we only evaluated 1 repetition under each loading condition, so that relationship could change if multiple repetitions were completed. We appreciate your time listening to our work, and feel free to reach out to us if you have any questions.